Hi, Dr. Lund here, your local Roseville and St. Paul chiropractor. And the video for this week involves talking about cervical disc herniations. So there's many structures that can cause neck pain. So we could have the ligaments or the muscles, and that's referred to as a sprain strain. But then we can also have a herniated disc. And so between each vertebra we have these discs, and they're shock absorbing structures, and within the middle of the disc there's liquid or jelly, and basically if that liquid or jelly herniates out, it can do so in many different directions, but if it does so in a direction that pinches or irritates a nerve, then that can cause symptoms related to a cervical disc herniation. So what are some of the common signs and symptoms of a cervical disc herniation? So typically this is going to be more of a severe pain, so that pain can be located in your neck, it can be located along a shoulder blade, and then commonly what someone is going to experience is pain that is going to travel into the arm. And generally the type of discomfort that travels in the arm is going to be a numbness or a tingling. If the cervical disc herniation is very large, a person may start to experience some kind of weakness in that arm. And some other signs or symptoms that can clue you in whether you have a cervical disc herniation would also include, does it hurt to bend your neck backwards? If it does, that can be a sign that a disc is involved. But typically with a cervical disc herniation, if you bend your head forward or flex it forward, generally that can give you some relief. Also, another common sign can be where if your arm is hanging down by your side, it's very painful, but if you raise your arm overhead, that will give you some relief. So those are some of the common signs and symptoms that indicate whether you can have a herniated disc. And chiropractic treatment is very effective at relieving both the signs and symptoms of cervical disc herniations. And so certainly you would want to try chiropractic treatment before considering any type of surgery, and if you do that, you'll be glad that you did. So hopefully you found this information helpful, and it maybe can clue you in whether you're dealing with a cervical disc herniation. So thanks for watching, and we'll see you next time.